Hello, Dr. Barbara Ferrer, the director of the United States Healthcare Department. My name is Hassan Sajwani, and I'm a concerned citizen, and I wanted to highlight some key issues in our current healthcare management, which is a major issue for the betterment of our entire society. Uh, The topics that we will be covering here will be a small introduction. We will also be discussing why the lack of resources and lack of workforce matters in our current healthcare system. What shortages are currently seen in the healthcare system in our LA County. And I would also highlight some of the consequences of nursing shortages and will also implement a solution and provide a conclusion. Um so, Dr. Doctor, I wanted to provide some data about the research done by the skilled nursing facilities. The skilled nursing facility consistently describes staffing shortages spanning all the job roles, including direct care, for example, activities, nursing, social services, support services, example, laundry, food, environmental services, and administrative and leadership services. The main source of these shortages is multidimensional. For example, competing salaries, family caregiving needs, and burnouts. The impact of shortages we felt by all the staff that stayed. Uh, in addition to existing job duties, those remaining staff experience redistribution of essential day-to-day operation tasks, example, laundry and allocation of new COVID-19 pandemic-related activities like screening. Cross-training was just a small factor that was used to cover a wide range of job duties. Uh, Dr. Barbara, I would like to highlight that healthcare forces shortages and inconsistent staff trainings are among the top threats to patient safety and equitable care in Los Angeles County. There is an ever increasing demand for healthcare services due to aging population and rising chronic diseases and mental health crisis. Uh, this issue represents, Dr. Barbara, this issue represents a real barrier and hardship for the remaining workforce and also creates a many hardship for the patients in the current healthcare system in LA County. I wanted to highlight why this barrier is an important barrier and why it matters. So lack of resources directly affects patient care. Since 2017, 17 maternity wards has closed in LA County. 13 of those are directly impacting low-income patients. And lack of workforce is a concern for patient safety and quality of care. Lack of resources, for example, limited access to care services. There are fewer available staff and patient specialists that patients struggle to get timely appointments or specialty referrals. Dr. Barbara, reduced continuity of care, high staff turnover disrupts patient-provider relationship, which is also leading to fragmented care and poor follow-ups. Lower quality of interactions between the healthcare workforce and the patients is due to the overload. Staff spend less time with each patient, but uh, more time in consultation and missed emotional and social needs. Lack of resources also increase patient dissatisfaction. Patient experience frustration, feel neglected, and may lose trust in the healthcare system. There are many negative impacts on healthcare outcomes, Dr. Barbara. Delayed preventive care and insufficient chronic disease management lead to worsening health conditions for our entire society. So, according to Cal Matters, some hospitals in Southern California have nurse vacancy rate exceeding 30%, significantly higher than the pre-pandemic average of 6%. This severe understaffing is contributed to burnout and early retirement among nurses. Along with that, Dr. Barbara, improper staff training have adverse effects on patient safety, operational efficiency, and workforce well-being. Healthcare system in Los Angeles County are grappling with significant resource shortages that impact patient care, staff well-being, and operational efficiency. Uh, Overworked staff are more prone to medical errors, medication mistakes, misdiagnosis, and missed procedures. And reducing time per patient lowers quality of care, affecting monitoring, counseling, and following up. Access and longer wait times for appointments, procedures, and emergency care, increase burnout, system level strain, equity, and community impact. I would also wanted to highlight the scope of the shortage. Uh, According to the Los Angeles County Nursing 2035 Initiative projects, 6,548 annual RN job openings will be expected up until 2035. However, only 5,363 nursing degrees or certificates are being awarded. This is going to be resulting in a shortage of 1,100 RNs per year. And if this trend continues, there will be an immense shortage throughout 2025 without any new graduates filling in the gap for the retired nurses. Many existing nurses are approaching retirement age, further increasing the gap between supply and demand. Among the 8 serving planning areas in Los Angeles County, there is severe shortages, others in medium or high shortage, meaning certain regions, particularly undeserved communities, experience more acute gaps in nursing staff. What are the causes of the nursing shortages? Insufficient education capacity. Nursing schools in LA County cannot produce enough graduates to meet growing demands, which is resulting to burnouts and an increase in the staff turnover, which causes high workloads and accelerated nurse burnouts and early retirements. LA County's growing and aging population increases demand for nursing care, especially in the hospital and the long-term care facilities. There's also a shortage of health force work gaps. The Los Angeles County Department of Health reports a 20% of vacancy rate, equating to about 1,890 unfilled positions out of the 4,800 health employees. This shortage leads to display in health services and increased pressure on existing staff. There's also a shortage on the primary care providers. Despite efforts to address the issue, California continues to experience a primary care shortage. Many Californians face months-long waits for appointments or have to travel long distances or go to an emergency rooms for unurgent medical needs, leading to overwhelming waiting rooms and unnecessary expensive care. Dr. Barbara, we also experience a hospital bed capacity challenge nationwide, including in the Los Angeles County. The number of staffed hospital beds are declined from a pre-pandemic average of 802,000 and a post-pandemic study of 674,000. This reduction in capacity, coupled with increased occupancy rates, strains the healthcare system's ability to accommodate more patients, especially during the peak times. Dr. Barbara, because of all these shortages, the available healthcare worker experiences burnout. The healthcare workforce in Los Angeles County is experiencing high level of burnouts. A significant number of healthcare workers have reported exhaustion, frustration, leading to increased unionization efforts and demands for better pay and improved staffing ratios. Here are some of the consequences of the nursing shortage. It's like a cycle: increased medical errors, high readmission rate, ineffective care, and then overload on the specialties and NRs, and then professional workload, which is irrelevant quality of medical aid. For a solution, I wanted to highlight that for the fiscal year of 2026 to 2027, I would like an increase of at least 10% from the last year budget of $6.2 billion. There we can see the improvement in many avenues. For example, we could hire more nurses, physicians, RNs, and other healthcare support staff to increase patient access to state-of-the-art healthcare solutions, provide and implement retention programs and professional development and training programs to improve patient safety and reduce medical errors. Dr. Barbara, this budget increase would bolster public hospitals and community clinics, reducing wait times and expanding services, especially in the undeserved areas. This is crucial as recent financial strains had led to reduced access and increased uncompensated care. Dr. Barbara, with the help of increasing the budget, we will be able to improve patient outcomes. For example, accurate diagnosis, advanced equipments in imaging, MRI, CET, PET scan, and laboratory equipment will allow for earlier and precise diagnosis, leading to timely intervention. It will also provide better treatment options. Modern surgical tools, robotic assisted surgery, and advanced therapeutic devices also enhances treatment precision and reduces complications. Dr. Barbara, overall, our goal is to improve the patient's safety. Equipment will built-in safety features, example, automation, infusion pumps, and monitoring system, minimizes human error and improves overall patient safety. Dr. Barbara, with an increase in this budget, we will be able to increase the operation efficiency and productivity. Faster services delivery, automated diagnostics and monitoring devices speed up patient care and reduces wait times. Reduced staff burdens, advanced equipment automates repetitive tasks, allowing healthcare professionals to focus on critical care activities. And it will also provide optimized resources utilization. Efficient equipment reduces waste, ensures proper medication dosing, and maximizes the use of hospital resources. Dr. Barbara, with the increase in the budget, we will be overall be able to do cost saving, reducing long-term costs. Early diagnosis and effective treatment reduces complications, readmission, and prolonged hospital stays. Dr. Barbara, with the help of extended budget, we will be able to decrease liability risk. Advanced monitoring and error reducing equipment reduces medical errors and minimizes malpractices risk. Overall, we will be able to improve access to care, more healthcare facilities, expanded coverage programs, and reduced wait times. With the help of more staff and resources means patients can be seen faster, decreasing delay in diagnosis and treatment. We will be able to enhance quality of care with the state-of-the-art equipment and provide more funds for staff training and ongoing professional development, certification programs, and competitive salaries to attract and retain skilled personal healthcare professionals. We will also be able to increase our operational efficiency by optimizing resource allocation. Adequate funding will ensure enough supplies, medication, and equipments are available at the earliest convenience, which will prevent in early intervention, reduce readmissions. Dr. Barbara, with the help of an increase in this budget, we will be able to improve the health of the entire community and work towards our common goal of a healthy society. In my conclusion, Dr. Barbara, increasing Los Angeles County healthcare budget by 10% would have transformation impact on the system. It would expand access to care by supporting more clinics, reducing wait times, and reaching undeserved population. The additional funds will also enhance the quality of care, enabling the purchase of state-of-the-art equipment, improving staff training, and strengthening patient safety measures. Furthermore, a higher budget would boost efficiency, support prevention programs, and reduce long-term healthcare costs. Ultimately, this investment would not only improve individual patient outcomes, but also strengthen public health, simulate the local economy, and position LA County as a leader in providing equitable, high-quality healthcare for all residents. Here are my references. I hope, Dr. Barbara, with this presentation, you'll be able to increase the LA County health budget to 10% more than that of the fiscal year 2024 and 2025. Thank you.